Recommendations when it comes to screening for breast cancer.
The U.S. Preventive Services Task Force now says mammograms should begin at age 40. Newswatch 16's Nikki Kreis explains in tonight's Healthwatch 16 report.
Healthwatch 16 is sponsored by Geisinger.
Mammograms are used by healthcare providers to look for early signs of breast cancer, and now officials are recommending people get them a decade earlier than previously recommended. The U.S. Preventive Services Task Force says mammograms should now begin at age 40 for most patients.
The message is clear, is that if you're 40, we want you to start screening for breast cancer with mammography.
Previous guidelines said women who are of average risk for breast cancer should start getting screened at age 50, and women with an increased risk should be screened at age 40. These new recommendations are something Geisinger radiologist Dr. John Farrell and his colleagues have been advocating for decades. He says breast cancer cases are increasing in women who are in their 40s.
By not screening women in their 40s, and specifically Black women in their 40s, we're missing. We're not diagnosing a lot of cancers in a timely fashion.
Dr. Farrell says these changes in screening guidelines are expected to save around 20% more lives. The new guidelines recommend screening for breast cancer every other year. There's still a little bit of work to be done, in our opinion, to get it to be every year, but starting at 40 is a major improvement in these recommendations. It's important to note if a patient is considered high risk, these guidelines may not apply. If a patient is high risk, they may need to be screened younger than the age of 40, and they may also qualify for additional screening tests such as ultrasounds or breast MRIs, in addition to an annual mammogram. Dr. Farrell says if one of your family members is diagnosed with breast cancer, that could change your own risk. Nikki Kreis, Newswatch 16.